I was the one who was caught unawares. But anyway, I really want to ask a question. How can you tell a husband to self-quarantine from their wife, really, honestly? Some of those things that we say are almost very ridiculous. Because, I mean, at what extent can you actually even know that you have the virus? Especially around now that there is a lot of coughing and sneezing and fever, you know. So I think, Mr. Speaker, remember in previous crises, people didn't even have masks to protect themselves. In fact, a famous cartoonist called Gado drew Kenyans wearing kasukus on their mouths to just depict the sense of unpreparedness. We really are not serious, because even those who were suspected to have coronavirus, the tests were done in South Africa. Not here in Kenya. There is no laboratory in Kenya that can actually successfully depict, leave alone the rather not so serious and not well-equipped health boxes that we find by the airport. And you see who cannot really control the people. Mr. Speaker, majority of the people who have died actually from coronavirus are nurses and doctors, including the famous one in Wuhan who discovered this. So really it's a pandemic, and you can be sure if it has come through these planes or whatever other means, we are more vulnerable as we are as Africans than any other continent in the world. And so therefore the deaths would be more, just like we've heard from the submissions on the floor with regards to the assessment by Bill Gates. And I think we cannot wait to see a crisis happening, Mr. Speaker, so that then it becomes another philanthropic endeavor of other individuals, so that we are relegated to the lower pecking order because we cannot self-protect. So, Mr. Speaker, I think it's only fair, because this is the Senate, and we are the ones in charge of health, that we summon the minister to come to this house and fully explains to us the preparedness of the country with regards to this virus. Otherwise, for her to issue a cursory, a declaration that when people are boarding the planes that the World Health Standards have been, organization standards have been adhered to, yet W.H.O is the one that is giving these warnings. I think it's exposing Kenyans to danger, and the government is there to protect the people. Mr. Speaker, I support.
Okay, Chairman, Health. Then,
I thank you, Mr. Speaker. This is a very, very important statement raised by Senator Ladama. And let me assure the House that my committee has already written to the CS to tell us on the preparedness of the country in this matter. And here we're just not addressing the issue of screening passengers entering the country, but we're also addressing the issues that in the event that we get a coronavirus incident in the country, are we ready to treat this condition? So those are the questions we've already sent to the ministry, and I expect an answer during the course of next week. They have said by Tuesday they should be ready. So by Wednesday I should be able to tell this House on the issue of preparedness. But one thing I just want to comment quickly is that the preliminary report from the CS, the office, was that the policy, they have a policy where they are screening each and every passenger coming into the country. And this screening involves just a quick check whether somebody has a fever or not. And that the guidelines of WHO are also very clear, where they say that let's not practice any discriminatory kind of actions against passengers. So it is a catch-22 situations that we're having. The issue of self-quarantine, this is one of the practices in medicine. You will find that there's total quarantine is the first step. Then the second step usually is self-quarantine. So next week, I promise this House that we will have a report on preparedness and ensuring that we will not have coronavirus in this country. And also, this statement should also go to the people who allow, because the Minister of Health does not, really control the planes that come to this country. So we should have other players, other diplomatic players, foreign affairs, internal security, immigration, to check on these things. If there's a situation in China that requires them not to come to Kenya, then certain measures should be put in place. So I thank you, Mr. Speaker.
Finally.
Speaker, from the work that we were doing with Senator Sakaja on disaster management and response, it occurs to me, Speaker, that this is no longer a matter of the Ministry of Health alone. And I just get a bad impression that it's possible that we have somebody here in Kenya who has this virus. I'm going to propose, Mr. Speaker, that you direct that the Cabinet Secretary in charge of disaster response recovery be summoned together with the Health Minister so that we, as Kenya, we can start thinking that it's possible that this might happen and we have not prepared ourselves. So, Speaker, I was going to suggest that you summon Dr. Matiang'i to come with the Cabinet Secretary in charge of health, because that portion of disaster preparedness is more worrying than even the flight itself. Thank you.